All right, so welcome and thank you so much, Gwen, for being here to present at our Care Week for this year. My name is Brittany Cormier. I'm the Executive Director of EOS Eco Energy, and I've been really looking forward to this presentation most of all this week to share the incredible work that you're doing in this position. As this is recorded, we are going to be uploading this video to our EOS YouTube channel that will be accessible if anybody would like to take a look once, twice, maybe a few times. I know that I will probably watch this a couple more times on my off days. And before I pass the baton over and get started, I want to take a moment to respectfully acknowledge that our work at EOS Eco Energy is done on the traditional unceded lands and waters of the Mi'kma'ki, or of the Mi'kmaq and Mi'kma'ki. And so I have a brief introduction, but absolutely add to this, Gwen. I have that you are the past director of Rural and Small Town Program at Mount Allison University. And you've been a huge help to our recent Health Adapt report that Tracy Wade has been leading. And within that, I got to know a little bit more about what you do. And I'm so excited that you're sharing it today as the current Regional Resiliency Coordinator of Southeastern New Brunswick. So a very tall order, a lot of things. And thank you for coming in to cover them all. If there's anything you would like to add, please feel free. And just, yes, thank you for being here. I'll officially shut down and stop talking.
Well, thank you, Brittany, for inviting me. It's always good. I like to do these little presentations because then people kind of get a better idea of who we are and the kinds of things that we do. So regional resiliency has been around for a couple of years now, but it's basically still in its infancy. Each year we get better. We really come into the role, and the problem with, or not the problem, the challenge with the Southeast region is that it's big. So, and I'll show you the map here after a while. It's not so that it's geographically big. We are the biggest population in the province. We also employ the most people in the province in this region. So, and because of that, and because of all the associated issues, there are so many more issues, needs, organizations working with them, and it's a little hard to cover them all, but we're trying. So here's kind of the agenda. You will notice that these slides are bilingual, except for one, I think, and it was just a big full slide, and I didn't even try to translate it. But anyway, I'm going to do this in English, but the slides are bilingual. So here's the context for regional resiliency. So we're focused on taking the learning from COVID-19, from ice storms, from floods, from all of those sorts of things, and how they were addressed and what can we do. So we learned that communities are not prepared for things like floods, ice storms, pandemics. Any pre-existing social issues become worse during those events, and that we don't very well understand vulnerabilities. So our resilient communities, I'm going to have to shrink you here because there we go. Resilient communities manage big problems better. And I think we've seen that in many communities all across the world. And obviously the one size fits all, the cookie cutter approach just doesn't work. So we need to build on what assets we have in the region, what organizations, what people, all of those things to make communities more resilient. Because we are government and many organizations that respond in emergencies are government-based, people kind of see us as a necessary burden and not necessarily a trusted collaborator. So we're hoping that with this initiative, that changes some. So we've learned also that an integrated and coordinated provincial approach is needed to support and enable community action. So That's the French slide, obviously. So why was this branch formed? It was formed to align government and community efforts to recover from pandemic impacts and impacts of ice storms, floods, all the rest of it, to help build communities' capacity and resiliency in future disasters and crises. So these are the kinds of things we looked at: addictions and mental health, transportation, community engagement, support of the new family reality, food insecurity, affordable housing, social supports to mitigate poverty, availability of local data, senior isolation and home care, access to primary health care services, and awareness of the services and the system navigation. So that obviously is becoming aware of what services are out there that can help in times of crises and after that, and how to get to them. So here's where we are. We are under the Department of Justice and Public Safety umbrella. And in that department, there is a Division of Security and Emergencies. So if you look at the bottom of the org chart there, MBEMO, the Emergency Measures Organization, we are right beside them and sort of their sister agency. So we realized that EMO, of course, responds to emergencies. So the question is, how can we help them? How can we help communities in dealing with the aftermath of those kinds of emergencies? So in emergency management, there are 4 pillars. There is the preparation, response, recovery, and mitigation. The 4 boxes that you see are some ways that we as community capacity and resilience can help with emergency response, or EMO. There are a lot of discussions going on around the province right now in how we can better work together. What kinds of things can we contribute to emergency management? What kinds of things does emergency management need from us? And how we, because we have or should have the community knowledge, how can we make the effort better coordinated and I guess better long-term? So we can help with better planning and coordination. We can do all kinds of things to inform emergency responders. We can certainly help recover and rebuild. And in their mitigation process, we can minimize future impacts. Okay, so here's our vision and mission. Vision of Brunswick communities are equitable, vibrant, sustainable, and resilient. And our mission is to increase collaboration among communities, government, NGOs, and the private sector by building capacity and aligning efforts to measurably improve economic security and employment, stable housing and healthy built environments, health, social service, justice, and education systems, and environmental sustainability. More on that to come. So here's how we have formed our little graphic of how we deal with community capacity and how we aim to build resilient communities. So if you look at the 4 colored boxes: economic security and employment, stable built housing and healthy built environment, health, social service, justice, and education systems, and environmental sustainability, those are all social determinants of health, and those are what community capacity and resiliency looks at as our 4 high impact areas. So you can see in the box it says community capacity reflects a set of knowledge, skills, relationships, and commitment within a community, and then supported by systems and structures that allow intersectoral action on matters of importance to the community, which makes it an important factor in community resilience. So what are resilient communities? They are communities that can use their collective knowledge, their assets, and their strengths to assess, learn, respond, innovate, and adapt. So resilience in this context is the adaptive capacity of the population to cope with the impact experienced through social capital programs and community supports. Okay, here's our provincial structure, just to make you a little bit more familiar where we are. So in the province of New Brunswick, there are 12 regions. Each one of those regions is centered around, or is defined by the Regional Service Commission boundaries. So 12 regional steering committees. So each region has a steering committee led by a Regional Resiliency Coordinator. Then we have the Community Capacity and Resiliency branch, the Securities and Emergencies, and Public Justice and Public Safety. So that's the provincial team that we deal with. So they support us, they coordinate the alignment network that you'll see underneath it there, and they chair the Assistant Deputy Minister Working Group on Community Capacity and Resiliency. So the Assistant Deputy Minister Working Group on Community Capacity and Resiliency is made up of Assistant Deputy Ministers and staff from 15 government departments. So you can see we've really got a good mix of people, departments who have all agreed that we need to collaborate on things more easily. So instead of going to the Department of Health for something and then social services and then here and then there, they see that, yeah, it's not good to work in silos. Let's get everybody on the same page. So again, 12 regional resiliency coordinators in 12 regions with 12 regional steering committees. My steering committee in the Southeast right now is somewhere around 70 people, which is fine. We are trying to get as many organizations as possible together to collaborate. Not all of those people are active in meetings that we have each month, but they're all on a distribution list and they are all welcome to participate at any time, provide their knowledge, and so on. Okay. So this map of the province, the red lines on the map outline the 12 regions. So you can see where we are down there in the Southeast. It's not really easy to see on a slide right now because the little legend is pretty small. So during the fall of 2023, and we did this also in the fall of 2022, Regional Resiliency Steering Committees came together to review the Regional Resiliency Action Plan. So every year we create an action plan, develop activities for 2024 with longer term outcomes, and submit the funding application. So each year each region receives $50,000 from Community Capacity and Resiliency for our upcoming actions. And what that means is that people can submit funding applications under the 4 high impact areas for parts of that $50,000. They all have to have SMART goals. They all have to have long-term outcomes, and they all have to have partnerships from other funders and or in kind. Okay, so here's our region. Again, the map is not that great, but anyway, this is region 7, as you can see. The orange areas are the what are called rural districts. Everything else is a municipality. So we have Moncton, Dieppe, and Riverview, Shediac, Sackville, and then our boundaries reach all the way out to Irishtown and Shediac Bridge on the north. So if you look along the north, and you see 39, that's Straight Shores, Port Elgin. 38 is Cap Acadie, 37 is Shediac. And then in the middle there where you have 34, 35, 36, that's Moncton, Dieppe, and Riverview. 32 is Three Rivers and Maple Hills. 43 is Three Rivers, 42 is Fundy Albert, 40 is Tantramar, and 41 is Memramcook. Cook. So that's the population that we cover. And like I said, it's a big region. It's not the biggest geographically in the province, but it certainly is the biggest population-wise. And it is the biggest in employment. Incidentally, it's also the biggest in numbers of homeless people. So the regional team, that's the team that I chair. So we have a steering committee, so we direct and support the work that's done. We have working groups from once the steering committees have decided their priorities for the upcoming year, then the actions are come out of those priorities. And so the working groups, each one of those looks after an action, a particular action that's been identified. So working groups or activity leads help to advance the activities carried out under the Regional Resiliency Action Plan. So the role of the steering committee each year is to develop a regional resiliency action plan, which identifies activities that will have an impact on the priorities. And then we complete an annual funding application, or those people who wish to lead activities complete funding applications. So just as an example, last June, we took a mostly all-day meeting, and we used a whiteboard or a mural board and created what we felt the priorities should be for the next year. And then in a couple of meetings after that, we listed what actions we felt would be beneficial to this region under those priorities. So then people who were interested in conducting some of those activities then completed the funding applications. It doesn't necessarily have to be someone on the steering committee who does a funding application. It can be someone who is invested in the issues, the actions, the priorities, and really has something that they feel is important to our communities and that they can contribute to. So then the follow-up, of course, is to ensure the work is accomplished, the activities have the desired impact. So every meeting we do an update on where the activities are. We keep a record of the invoices and all those kinds of things. Okay, so here are the regional partners across the province, and I don't know, this one again is a little small, but you'll see listed, well, down the side and in the pie chart, who the regional partners are that are involved in the resiliency initiative. The large part of them, of course, are provincial government, which in some region, it differs from region to region. So that may be higher in one region than it is in another and so on. But, you know, it's whatever works best for the region. I have a mandate to approach different organizations all the time to ask people if they would be interested in joining the resiliency committee and just explaining who we are and what we do and what we'd like to accomplish. And of course, the objective is that we are collaborative on everything. We don't work in silos. So, and that's what I was just saying. We recognize there are many groups targeting social issues. Our aim is to bring everybody together to create sustainable networks to increase the region's capacity. So getting out of those silos. So back to the 4 high impact areas. These are some of the kinds of things that affect our actions and our priorities. So regional resiliency priorities you'll see on the left there under the high impact areas, and those are, of course, the economic security, the stable housing, the health, social service, and environmental sustainability. So when we look at what our regional priorities are, that's where we start. So what kinds of priorities can we identify under each of those 4 impact areas? And then from that, which actions can we actually undertake that are going to make a difference and a long-term impact on the region? Obviously, with only our $50,000, we can't do huge, like we can't solve the housing problem. We can do little pieces, but we can't solve the general housing problem with that amount of money. There are a lot of people who, when they submit their applications, they have to have funding from other partners or in-kind funding. And sometimes the funding is there that they can do much bigger projects. Sometimes it's not. This is an illustration of the Resiliency Action Plan for Region 7 in 2023. So these are the activities that were done in 2023. So starting at the top, the Seniors Meal Program, that is a program that is done by the United Way. It's a free meal program for seniors. They deliver meals to seniors. In 2023, this was a program in Moncton. They served over 100 seniors. This year, we have extended funding for that. They were also able to get some additional funding so that they will be delivering meals to seniors around the region. And right now, they're looking at more than 200 seniors with that program. So Manger Frais is it's a food box program in Memramcook. This is a program where, and I think many of you probably know this, you come and you pay your membership fee and you get your food box. The number in blue is a number that was carried over. So for example, if a project was not completely finished in 2022, this $6,000 gets carried over to 2023, and then the additional 3,500 is for 2023. The community garden program was to supply wash stations for community garden at the community hub. If you have not been to the community hub on Joyce Avenue in Moncton, it is a lovely facility. It provides a lot of housing for people who would otherwise not have housing. It has a lovely community garden. And so this wash station was a very simple thing that people could come and get their vegetables and wash themselves and take them home. Support for school food prep programs. I think everybody is aware that every school these days needs some sort of a food program. This is something that's increasing every year. So last year, the $10,000 was carried over from 2022, and it went $5,000 to Anglophone School District East and $5,000 to these District Scolaire Francophone Sud. So each of those school districts had $5,000, which they put towards food programs in the schools. Transportation for food bank clients. This is actually an interesting project. It's spearheaded by Urban Rural Rides. And what it does is it provides access for clients of the food banks to get there. So you could probably realize there are a number of people who, for whatever reason, they don't have a car, they don't have a friend that could take them, there may be some disability, that kind of thing. So Urban Rural Rides provides this transportation. The clients are referred from the food banks in Westmoreland and Albert counties to Urban Rural Rides, and then they take them to the food banks to get their food. Or if the client really cannot get to the food bank for whatever reason, they will provide the food box, they'll deliver the food box to them. So under access to services, the Safe Talk sessions, those were done for both school districts, and the intergenerational community connection that, as you might guess, was targeting school-age students with seniors who may be experiencing social isolation or some mental health issues, and also help to, as you can see, increase the mental health resources for youth. So those were two separate projects. The Safe Talk project was $5,500. It was carried over from 2022, and then $4,500 for the intergenerational project. Cell phone access, this was for Ensemble Moncton. They realized that many of their clients, so these would be folks who were homeless, basically, many of their clients did not have access to health services, justice services, social service. So they got used cell phones, and they had someone who works with cell phones in the area who refurbished them. The cell phones are only for phone calls. They're not, I mean, they can't go and play games on them. They can't use Facebook, any of those things. So they're only for phone use, so that they can be connected for their health services, for their justice services, and for their social service meetings. Under the Food Industry Certification Pilot Project, this is an employment program, and this one actually had difficulty getting off the ground last year, so it is carried over for 2024. This is an employment program that will provide certified training for knowledge and skills for youth who are at risk. So this one's led by the Peter McKee Center in Moncton. They have gotten a volunteer chef on board, and he will take a group of, I think it's 15 young people who don't have skills, may have left school, they're at-risk young people, and they will learn how to cook and food safety and all those issues associated with that, coming out with a certificate which they can hopefully then use for employment. And the last one, under community capacity, is the 7th Generation Cultural Camp. This is a camp that is led by Fort Folly First Nation and supported by various other First Nation communities. So what they do is they hold a 5-day retreat for underprivileged or at-risk Indigenous youth. This one has really blown up. We are funding this one again in 2024. They are taking at-risk youth. They are teaching them their culture, food safety, food harvesting, survival. They're also doing things like just personal things, how to interact with other people, how to have job skills, how, peer success, and all those kinds of leadership abilities and so on that we don't often see in a lot of folks that may be at risk. This one has, as I said, it's kind of blown up because they went on to do a fall program in which they do a fall rice harvest. That's part of that one. This year in February, in a couple of weeks, next week, I think, they are also doing a winter camp. So this is really an interesting project. They've done some videos with this one, and they participate with Ducks Unlimited, with Canada Wildlife Service, and all kinds of different groups. It's a huge project, so it's pretty interesting. That's the French version. Okay, so this one is the one I didn't translate. So you folks are probably wondering, well, this is all nice, and we're talking about social determinants of health, but what does this have to do? What does resiliency have to do with climate change? So I just thought I'd throw this slide in. because you might be, and I'm sure many of you have probably seen this before. We all know that climate change affects human health in all these kind of more physical ways. What we look at in resiliency is how does it affect people in social ways? What are the social determinants that come from climate change? And this is where I was really interested to participate with the project, the Health Adapt project, and how climate change affects people's health. So here are the people that have the greatest challenges from climate change: pregnant people, young people, people with pre-existing health issues, people who are underhoused, socially, economically disadvantaged, older adults, systematically marginalized groups, socially isolated people, and outdoor workers. So those are the kind of people who are a little bit more uh, susceptible to effects from climate change. These are the people that, in some ways, sort of fly beneath the radar because they're not obvious. So these are the kinds of people that we want to be aware exist in our communities, particularly in times of crisis, but at any time, really, because climate change is not just a one-time time of crisis. It's there, it's happening. So those are the kinds of people that are parts of the projects that we do and people that we look at when we think about climate change and health risks. So as I said, we have annual funding that's available for regional resiliency steering committees to obtain support and identify actions arising from our long-term action plan. So in November of each year, we have all of these, I have received by that time, all of the funding applications. And then I have a committee that reviews them all and decide, how are we going to split up this $50,000? Does the person who asked for 20,000 of it get the 20,000, or do they get part of that? Because as you can realize, $50,000 is not a lot of money. So, but if, again, you can encourage people to have partner funding and in-kind funding, that makes it go a lot farther. And actually, the in-kind funding is just phenomenal in these projects. And that's pretty much it for what we do and who we are. I'm certainly willing to take any questions.
Thank you, Gwen. That is a lot of information to relay.
It is.
I really appreciate your well-collected and organized slides, and it's just, yeah, it's very impressive work. I'll open it up to the floor. I have a few questions myself, but if anybody who is joining us today has any questions, feel free to put them in the chat, or you can unmute yourself and ask directly. Or if you would like some time to think about it and consider, then maybe I'll start. So, I mean, with your legacy of impact and the work that you've been able to do, not just with the province, but with your work with Monet and the rural communities, what would you think are the best pathways for rural communities for resiliency? And your region covers, like you said, a huge population in New Brunswick. And it's always the worry I hear in some circles about really creating the pathways and getting the work done in rural communities, whereas they're fighting for resources with municipalities such as the city of Moncton. So I know that that's a big question, but if you have any thoughts to share.
Yeah, that's a very valid question because that's come up a lot with the steering committee. And as I have all those people around the table and we're discussing projects and things that are happening, invariably somebody says, that's great. How do we do it in the rural areas? So one of the activities in particular this year is a communications thing. So what people realized was that people, particularly in rural areas, were not necessarily um, did not necessarily know about everything that was happening or things that could impact them. So there's a whole communication strategy underway. There will be some, I think, 4 this year. Right now, we're calling them resiliency days, for lack of a better name, in rural areas. Just it's like almost like a little tiny trade show. So we have different people there and present to them, here's what we can offer you. Here's some knowledge that you may not have. Here, what do you need to know that you don't have access to? So if you're a senior who just doesn't do computer stuff, here's where you can get the information. Here's how we can help you. Here are the services that are available for you. So those are one of the things that we're doing. But it's really, of course, working at Mount A all those years with rural areas and small towns, that's my thing. And so I sat on municipal council for 10 years, ages ago. And at the time, this was when regional service commissions first were coming into being. And I thought, oh man, this is just, we're going to be drowned because of Moncton, Dieppe, Riverview. And to some extent, that was the case back then. And to some extent, I think it may be the case now, although from working with the Regional Service Commission and from working with all the people on the steering committee, what I'm seeing is that people are really going, oh, there are other people outside of the city, in Petitcodiac, in Fundy, in Hillsborough, in Alma, in Salisbury, in Port Elgin, there are all those people and we need to reach them. So there's really a concerted effort around the table to make sure those people are included. One of the things lately that we've kind of went, oops, we forgot, is the rural districts, right? Because there are still rural districts in each region. And so these people are not necessarily tied to any kind of municipality. So the question is, how do we make sure they're involved? How do we make sure they have the services they need, or they can access, or they know where to go to ask people? So there's the steering committee, I think, is really making a concerted effort to make sure we involve those people that are outside of the cities. And it's not an easy job sometimes because there's so much to do in the city. Like Moncton, for example, has over 400 homeless people. That's a lot of people to deal with. And that issue in itself is huge. Never mind the housing issue, but so I think we're talking about homeless and housing and so on. And what people don't realize is that just because you don't see them in Salisbury or Sackville or Port Elliot doesn't mean they're not there. They're still there. They're just, So yeah, I'm really happy to see that the steering committee is really making an effort to get in touch with those folks that live outside the city.
For sure, and it's no easy task. I mean, the high priority list that you went over, they're all crisis individually and all interconnected. Like these are very tall issues that you're trying to prioritize. I have a note here that just says, how do you prioritize? Your time management skills must be impeccable.
They're interesting, yep.
Would love to see your work plan charts.
Yeah.
How has the amalgamation changed since some of these rural or local service districts have been amalgamated into things like such as Tantramar, Sackville, and Dorchester, and local service districts are all together now. So does this make it easier to communicate? Does it make it more challenging for your steering committee to kind of reassess the region that you have, since you have Sackville, but not necessarily the rest of the municipality of Tantramar, is that right?
No, I have them all.
Oh, you have them all. Never mind, that's fantastic.
Well, in the beginning, when they first asked me if I would do this job, I went, oh boy, here we go. Now when they said Regional Service Commission, and of course, being on municipal council back then, Regional Service Commission was a bad word. He went, oh, they're just going to steamroll everybody, right? So I thought, oh man, yikes. Sure, I'll give it a try. But like I said, when we were talking a minute ago, what I'm finding is that the Regional Service Commission has hired every Regional Service Commission has hired a community development person. In this region, there are two. So, and I don't know if anybody's familiar with, there's a group in the province called the Economic and Social Inclusion Corporation, ESIC. And they had what they called CIN coordinators, community inclusion coordinators. So a number of those people are the people that the regional service commissions have hired to do community development work. So they know what's going on in the communities. And I'm really, again, back in the day when the service commissions were first formed, they were kind of top down. That was it. They were top down. And now I'm really seeing the effort to go outside the city and work with those communities. So, and I meet regularly with the community development people at the commission. And for example, we're going to be doing ESIC each year does community dialogues in each region. So we're going to be doing 6 in this region outside of the cities. So there'll be one like in Riverside, Albert, and there'll be one in Sackville, there'll be one in Port Elgin, those kinds of things. Where before the previous set, there were only 2 meetings, and one of those was in Moncton. So I'm really seeing a concerted effort to get to those people who are outside of the city. Because there's a lot of socially isolated people out there.
There are, and I know that we've discussed in the Health Adapt program or report and work that these are the people who are at risk. And in climate change, the impacts of isolation, mental health, too, to be considered, and all of these things that are making it more hard. But we also had a webinar with Dr. Leifer that said, and I've been using this a lot this week, with multiple issues come multiple solutions. So
Yeah,
there's still, yeah, a lot that we can do.
definitely. We have a couple of community developers. Horizon Health employs community developers, as does Vitalite. I think they call theirs are public health. Anyway, they are in the rural areas. So in this region, we have a community developer in Fundy Albert, and we have one in Tantramar Strait Shores, and they are wonderful people. They get out there and they know their people and they know what's happening in their communities. So they're a great resource for us too.
That's great. And that's awesome to hear. You really need a good team of people to really
We
meet,
do.
yeah, the community where they're at too. How do you find the engagement is in your steering committee and with your partners? Like, has it changed and since everything started? You said that there's an email or probably like a list that everybody's kind of involved, and as we open up a bit more in this pandemic, I'm sure it's difficult to coordinate meetings. I don't know who it is, but how is the engagement?
The engagement is actually pretty good. I'm surprised, because that was another thought of mine when they said, will you take this job? I went, oh my Lord, look at how many people are on that steering committee. And I've just kept adding to it, right? And so how do you keep that number of people engaged? Well, some of them sort of drop off, but every once in a while they pop up and they say, oh, I heard about this, or what about, or do you know about this, or can you spread this to the rest of the people? So we're basically a network. Whenever we have a meeting, we do it hybrid. So of course, in person or online. And I think even though I would rather do meetings completely in person, but I'm a little old school, even though I'd rather do that, um, it really engages a lot of people. So, there's obviously a lot of people online, and that's fine as long as they're there participating. And I will get a lot of comments from people when we send out the minute meetings and all those kinds of things. I get a lot of feedback from people who are simply, I just want to be on the distribution list. I just want to know what's going on. And they're still part of the network, so you can still call on them.
And it's nice to have those resource people too to call on, yeah, when you need. Um,
Yeah,
and know
I'd
that.
like to see a little bit more involvement from our municipalities. Like we
Mm.
do have municipal representatives on the steering committee, but there hasn't been a lot of engagement. They have come to a few meetings, but there's not a lot of, like, everybody's busy. I get that. But I'd like to see a little bit more involvement from the municipalities. That's
How do you
all.
encourage if anybody would like to get more involved from a municipal or a different sector? Do they go to you directly or is there a
Yep.
process?
No, they can just come to me directly and
At the
I,
farmers market on your email as well?
yep. Um, I, uh, I get a couple. I'm just trying to think of how this week has been. I think I've had like three people introduced by someone else on the committee and said, here's this person, they're interested. Sure. Collaboration is the word here. We want everybody on the same page. And it's not possible. You're not going to get everybody on the same page, but if we can get as many people as possible, you know, why have all these silos out there when we can do this together?
I completely agree. And I love that theme in your presentation too, of breaking down the silos and having all of these different
Uh,
perspectives working in one way together. Instead of, which, as silos present themselves, sometimes you have the same projects going that could just be collaborative. So yeah, I just want to ask, I have one more question, by all means, if anybody has anything else. But climate change is obviously something that we're very interested in making sure is part of the resiliency conversation. And
yep.
is the engagement of the steering committee and in your work, do you find that it's a big part of the conversation in people that don't necessarily specialize and work in it every day, or does it get forgotten? And how would you recommend we bring it back? Like for something as simple as municipalities for the amalgamation have to redo municipal plans and are trying to prioritize things. And as climate change impacts a lot of these things that we are planning about, sometimes it's falling by the wayside. So in your experience and in your steering committee, yeah, how is that going?
Climate change is in our region. It's a it's a little off to the side. It's there. People talk about it. But because of the issues that we have in this region, the more social issues, healthcare being the biggest one, it kind of gets a little shoved off to the side. We do have some, when we're doing, particularly when we're talking about priorities and actions for the coming year, it's always there. Or somebody will say, but wait, what about the environment? What about climate change? Oh, yeah. So let's talk about this and this and this and this. And it's one of those things that I'd like to see have a bit higher profile with the steering committee. I don't think it's something that's forgotten because the discussion does come up on a regular basis. We had some folks that wanted to do a project, an activity, sorry, this year, but the project was so big and they could not get funding from anywhere else that the money wasn't there, right? Which really is the sad part for me with climate change, because to me it's a huge issue. It's something we should all be working on, but it seems that in the big picture, the money's not there. So there's a disconnect between the funding and the issue.
I'd have to agree, though. Looking forward to the future and hoping that improvements are made. The climate crisis is hard to ignore, but that's great that it's still part of the conversation. And do you think that the health adapt and relating it to health has been helpful in other sectors recognizing the importance of continuing the work and that it is a lot more interconnected?
I certainly hope so. I think
I
the,
do.
yeah, I think the thing that we have to do with things like the Health Adapt project is get that information out there. You know, we can't just write the report, present to council, and all go home. We've got to get that information out there to the broader audience, which is one of the things that we can do as a resiliency committee. You know, we can send that to our government colleagues. We can send that to communities. We can send that to different our Horizon community developers. You know, if you know this information, then you've got something to work with. You can't just say, "Oh, we know it's an issue, but why is it an issue?" You know, so I think if you could get that information out there to people on a broader basis, we'd certainly be farther ahead.
Absolutely. Well, I'll take that as my to-do list and a takeaway from this event. And I'll open the floor if there are any questions from people who've joined us today. I know that I've taken a lot of our question time, but thank you so much, Gwen.
You are very welcome. And certainly if anybody wants to be involved with the steering committee, wants to take a closer look at what we do, give me a call, email me.
How do we
Um,
find you, Gwen?
how you find me? Okay, big long email, and I don't know why the government did this, but they did. So it's Gwendolyn dot AE dot Zwicker, Zwycker at gnb.ca.
That is unusually cruel, but
I
if
know.
it's okay with you, I would like to share your email with participants, and that'll be easier to copy and paste.
Yeah.
But that sounds great. Thank you for that offer. And if
No
anybody has any
problem.
follow-up questions, do you mind if we also send them your way?
No, absolutely.
That sounds great. I will be asking you for coffee too, because I have a few more follow-up questions.
Okay.
But I think we'll have a close here and let Gwen get back to your busy schedule. I see a great information and presentation. Thank you from Roland. And from us as well, thank you so much for spending the time with us at this presentation. And I've I've learned a lot, and I'm sure that it's going to be really great to share this as well. So thanks so much, Gwen. I'm going to stop recording if I can figure out how to do that.
Well, thank you so much for inviting me. I love to